Geological usually publishes on a weekly basis, but with the spread of the coronavirus into the United States and the current uncertainty around infection rates due to lack of testing, we're bringing you extra episodes that we hope you'll find helpful as we navigate ourselves through this challenging time. This is a short conversation with Craig Mitchell in which we discuss the current COVID-19 situation as it's unfolding here at the beginning of March in 2020. Not surprisingly, the Chinese medicine internet has been lit up with discussions about what kind of pathogen we're dealing with, herbs that are being used in China, and what plans practitioners are making here in the West, as it looks like it might be our turn to use the methods that have come down to us over the centuries in service of dealing with this modern epidemic. A big takeaway that I want to mention up front, because I think it's worth repeating, is that we're dealing with a highly contagious pathogen. And while we might be eager to do our part to help, it's vitally important to ensure that we're not inadvertently helping to spread the disease. A keen eye and an abundance of caution in keeping our clinics clean and disinfected is essential. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out their new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear Don't Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Geological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lau, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com. And where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AccuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, That number has grown to over 50,000. So break the routine. Be the change. Visit AccuFastNeedles.com. Your patients and the planet will thank you.
We all know that it's better to prevent disease than to have to cure it. If you're not up on the latest sanitation measures and guidelines, it's best to educate yourself and start now making sure that your clinic is safe for your patients, employees, and for yourself. Craig Mitchell, welcome to Geological.
Thank you for having me, Michael.
We were talking earlier today about this COVID-19 situation. It's, of course, all over the news. It's all over the interwebs. Partly we were talking today because so many acupuncturists are receiving emails, all different kinds of notification. There's protocols. There's use this formula. There's go buy a boatload of Ping-Fang-san. And I wanted to talk to you because I've been kind of scratching my head and going, wait a minute, are we doing Chinese medicine out here?
Maybe not. Yeah, I think we are in a unique situation, and it's one that I think we have to, as a community, think quite carefully about. We do, I think, need to look at patients that we're seeing as we always do, which is through the lens of the diagnostic systems of Chinese medicine. And that means using differential diagnosis. And that means that while any particular given protocol or suggestion that might be coming out of China or from anywhere else for that matter, that we need to think carefully about that from the perspective of the actual patient that we might be seeing at a given moment in time, just as we would with anything.
Of course. We both had a chance to experience SARS a bit. I was living there. You were actually coming through at various points and going to school. You were doing your PhD at that point. And I remember when SARS really first started to happen, the Bonline gun was like gone from the pharmacies because people were making this assumption, oh, this is a viral thing. We're going to use this antiviral herb. And it was so surprising to me. Here I am, I'm studying in China. It's like, great, I'm going to get the real Chinese medicine. And yet people were using the Chinese herbs as if it was a Western medicinal. It was very confusing to me at that moment.
Yes, I agree. And frankly, I don't think that approach during that situation was particularly effective. I mean, it's one of those situations, Michael, as you know, right? What is that saying? Even a blind squirrel occasionally finds a nut. So, was there someone that helped? Yeah, probably, right? Probably there was, but I think you and I have both been practicing Chinese medicine for a long time now, and I think for every patient who comes in and is complaining of a fever and a sore throat, for every patient that we've found that Yin Chao San was effective for that patient, there are a whole handful of patients where it turns out that we needed something quite different than that. Maybe we needed Mashing Shugan Tong. Maybe we needed, as you and I talked about earlier today, maybe there's a damp component in the patient's situation, and we needed Sanren Tong, which is one of the formulas that I've heard some people talking about using for this COVID-19 outbreak. But the bottom line is, if you don't actually assess the patient and you don't see what's going on with them, none of these formulas are necessarily going to be helpful for anything.
Right. I remember when I was in Chinese medicine school, and of course, one of the first formulas you learn about is Ping-Fang-San. It's like, oh, this is really helpful for, I'm using air quotes here, immune system.
Right.
And I've always had weak lungs, and I thought, okay, cool, I'm going to start taking this stuff.
Mm-hmm.
And I took it for a couple of weeks, and I woke up one night in the middle of the night freaking out because I thought my house was on fire. I was smelling like the smell of smoke. And it wasn't because my house was on fire. Actually, I was on fire. I'm already kind of a dry guy, and that stuff really dried me out. For a number of days after that, it's like I smelled smoke everywhere I went. I finally realized, wait a minute, maybe this is not the right thing for me.
That's amazing.
Yeah, it was one of those moments where I began to realize there's stuff that we read in the books, there's things that we hear from our teachers, there's things that we say to each other. And we go, yes, of course that's true. And yet that really woke me up to depends on the person, depends on their physiology, depends on where they're strong, where they're weak. I'm a dry guy. I used a formula that dried me out.
Right.
I literally set myself on fire.
Well, the best practitioners with whom I've had the opportunity to work, whether it's here or in Asia, they are people who are able to think flexibly about situations, and they are people who are, I think they go into the treatment room open to being surprised by what they are going to find.
Mm-hmm.
So they don't go in with some kind of a predisposition. They don't go in with some idea about, oh, this patient has whatever the condition is you want to talk about. Oh, they have asthma, or they have irritable bowel syndrome, or they have COVID-19, and I already know what that's going to be based on the Western diagnostic assessment of that. That's not coming through the lens of Chinese medicine. If our experience is any example, our treatments will not be as effective if we use that strategy to make decisions about our patients.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. For me, one of the joys and one of the difficult things about Chinese medicine is to cultivate that sense of being able to walk into the treatment room a little bit empty, a little bit open to what's actually here.
Agreed.
And I mean, for me, I find that to be part of the joy of practice, but there's times I walk in and there's still that sense 20 years later of, oh my God, what do I do with this? And to somehow learn to get friendly with that.
Yes. Well, and I think also, Michael, I want to bring up one other point that you and I touched on when we initially spoke today. If we ask the question in a vacuum, if we say, well, is Chinese medicine able to effectively treat COVID-19? That is one question, and maybe that's an interesting question. I also think, however, that as a community, we also have to think a little bit about what we're doing and whether or not we're being responsible to our own community and to the other patients with whom we interact. We have talked about the fact that there is a huge amount of uncertainty out there still about the transmission of COVID-19, about the incubation phase of COVID-19, about the mortality rate associated with it, the severity of the presentations. And so I think that as a community, well, let me just say for a moment. So as you know, Michael, I am involved in running the Seattle Institute of East Asian Medicine. It just so happens that King County, where our school is located, is one of the first places in the United States to get a significant number of cases of COVID-19. And so we have kind of been, as a school and in our clinic, trying to determine what is the appropriate response to this. And while we are keeping our clinic open for the time being, we are actually asking both our students, staff, faculty, as well as our patients who have active respiratory symptoms not to come in. So people, certainly if they have a fever, but even if they have an acute onset upper respiratory situation, we are asking them not to come in. And the rationale for that, and I know this may not be what some people in our community want to hear, but the rationale that we have applied is that it is difficult to know what the trajectory of this illness is going to be. And we don't have the ability, at least in our clinic, we don't have the ability to isolate people. Our clinic and our school are all mixed together. Everybody is literally, in the same rooms, crossing in the hallway, using the same bathrooms. And what we do know about COVID-19 is that it's not only transmissible through respiratory droplets, but it appears to have a significant longevity even when it's on a surface. And so we feel that we have a responsibility to the other patients in our community to take some reasonable steps to ensure that we are not unintentionally exposing people to this illness in a way that would not be responsible. And whether or not at some point in the future, we may end up being some of the frontline people who are trying to get a handle on this kind of a viral infection, given the fact that Western medicine doesn't have a lot of great tools for this. And while I understand and appreciate that, I also want to show what they call an abundance of caution with regards to how we're doing that right now.
Well, this kind of gets back to do no harm.
Exactly.
And this is a contagious pathogen. Clearly it's a contagious pathogen. I mean, it's spread around the world very quickly, much quicker than SARS did.
Yes.
The other piece is we didn't have the same social networking, cell phones, deep interconnectedness back in the early part of the century that we do now.
Mm-hmm.
Sometimes it's hard to know how much of it is this is a virulent pathogen, and how much of it is, well, our social fabric is really different now than it was 15, 20 years ago.
Absolutely.
That's a whole other question. I don't know if it's part of what we need to get into today, but it does point to the deep uncertainty that we have. And so doing anything that we can to make sure that we're not spreading this
Right.
would be really, really helpful. I understand we all want to help. I was talking with my buddy Toby Daly the other day. We were talking about acupuncture and how we might help, and we were both talking about herbs as well. And we were both thinking, we could do some kind of remote thing where you're talking to people, prescribe them some herbs, drop them in a place. You guys never touch each other. It might not be a bad idea. I mean, just because we don't want to infect other people, we don't want ourselves infected. I mean, we're not going to be much good if we're sick.
Well, and one of the difficulties with this, and frankly, it's one of the things that's given us great pause about even keeping our clinic open at this point, is that people can be infectious before they're symptomatic. They don't even know yet. And so, we have gone through, I have to give a little shout out to the academic dean in our program, Kathy Taramina, who spearheaded this major effort over the last week. We have disinfected the entire school. We wiped down every surface. We got rid of a huge amount of pillows and towels and things that we couldn't clean properly. And we've just made it as clean a site as we can possibly make. And we're still uneasy about staying open and having patients come through who we don't know what their infectious state is. And so I do think that I don't know, maybe I'm getting old, Michael, but I feel like a little bit of a conservative approach here seems appropriate under these circumstances.
I think abundant caution is not a bad stance to take.
Yeah.
Where are you taking your leads from? Where are you going with CDC guidelines? Are you getting something from King County? Where do you get your leads for deciding, do we stay open? Do we stay closed? What kind of precautions do we take? Are you doing any kind of record keeping? What are you doing there?
That's a great question. So we have been monitoring CDC communications for sure. We have a fantastic public health department here in King County, and they have, I mean, there is a state of emergency in Washington state declared by the governor. So there's a lot of resources coming out, both written resources, but also in the last couple of days, the University of Washington has just gotten fully set up to be able to do testing for COVID-19. And so I think we're all expecting to see a significant increase in the number of tested patients, which I think will be potentially very helpful in terms of understanding the spread. We often do things based on the decision-making process that the Seattle Public Schools use. And right now, King County Public Health is encouraging schools to stay open. They're encouraging schools to take these kinds of precautions in terms of anybody with respiratory symptoms not come in, people minimizing unnecessary physical contact, limiting the number of large group settings, and being super careful about hand washing and hand hygiene generally. And so we're looking to these organizations to help us in our decision-making process. We have instituted something which we haven't used before, which is basically we keep a log at our front desk of everybody who comes into our facility. And we have a conversation with them about travel and about any respiratory symptoms that they've had. And that's partially to potentially screen somebody who's not thinking about what some potential exposure might be that they've had. And it's also to make sure that if we were to be in a situation where there was an exposure on campus, that we would be able to contact people who we think, might have been exposed to that person.
You could catch the various vectors if they happen to show up.
Exactly.
That seems really prudent, especially if you're a school or a large operation of some sort.
Right.
That makes a lot of sense. It's like public health 101 in a way, now that you mention it.
Yeah. I mean, the other question, and that I initially I thought when you were asking me where are we looking for input about this, my initial thought was what classical texts are we looking at?
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital chi, and that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
I wanted to get to that as well because, there's some stuff coming out of China that we can read and think about. I mean, I've seen some of this stuff that's been emailed, and, one way of looking at it is, oh, here's the herbs I should use. But I look at it and I go, well, what are they seeing? What are they thinking? Right? Use it as kind of a case study, like a thought experiment to kind of sharpen up the saw, so to speak, for thinking about differential diagnosis. So those can be useful, but yeah, what about some of the more classical materials?
Well, I think from what I understand, I mean, one of my teachers here in Seattle, who is Chinese and who has a lot of friends and family who are in China, he's been in practice the better part of, I guess, 50 years or a little bit more. And his take on this, this is only one person, but it's based on his extensive experience and information that he's getting from China, is that probably a warm disease strategy, something from the Wenbing tradition, might end up being the most effective thing, in part because it seems as though many of these kinds of conditions have a damp heat type component to them, or damp warmth in the kind of parlance of worm disease theory. And so those kinds of conditions arguably might be more effectively treated with formulas from the Wenbing tradition, like Sanren Tang I mentioned earlier, or Hoapo Xialing Tang, or one of those, those are in that damp warmth kind of framework. I have heard about people using other things, some things from the Shanghan Lun as well. I imagine that that's quite possible, that those formulas could also be effective. But again, as you and I keep talking about when we discuss this, those are all possible. They're all fair game. And until you're actually sitting down with a patient and doing a careful analysis of their signs and symptoms, how old are they? What was their state of health before they got sick? Where were they exposed? What's their living environment? What are their current signs and symptoms? And then doing the differential diagnosis, that's such an amazing strength of Chinese medicine. In a way, Michael, I think, to me, this really points out that the real value of our medicine, aside from its efficacy in treating complex diseases, lies in differential diagnosis. And so if you're giving up your differential diagnosis and just choosing a formula because someone from China said that you should use that, that seems really unfortunate, and like you're not serving your patients as well as you could under other circumstances.
You mentioned Sanrentang, and this is kind of you don't hear about Sanrentang that often, at least I don't. And I know that I had a conversation with Qin Zhao a little while back, and he's been using God, the other formula that you mentioned. The name just went.
Paul Xiaolingtong?
That's it. Yeah, yeah. He's quite keen on that because as he's been seeing this, at least in Wuhan, where it's cold and it's damp and there's toxin, you need that like super aromatic stuff to disperse.
Exactly.
So, and of course, if this illness shows up in a place like Arizona, that might look different, right? Or Southern California. Again, we need to see how does this manifest in a certain person in a certain place. That being said, could you talk to us a little bit about Sanrentang for those who may not be familiar with it?
I think that Sanrentang and Huopo Xiaolingtang are formulas that, one of the things that's interesting about them is that they can both be used for externally contracted illnesses, but they can also be used for damp heat type conditions that are internal as well. And so the difference between the two formulas, and everybody can look them up in the formulary, has to do with the relative proportion of dampness to heat in the different patterns, right? So that's one of the key differentials between those two formulas. But essentially, what you have in a formula like Sanrentang is you're using substances that are, as you mentioned, that are aromatic, that are opening, that clear away dampness, and that are both opening the upper burner, the lungs, making sure that the lung qi is flowing smoothly, using something that's aromatic and dampness dispelling for the middle burner to make sure that the transformation of dampness is happening properly in the middle burner, and then also using substances that have a diuretic quality that are helping to clear dampness through the urinary system as well. So, Sanrentang is one of these interesting formulas that it works really by stimulating the metabolic pathways in the body that transform fluids. And that means lung, spleen, kidney, urinary bladder in this case. And so I think one of the things that sometimes makes that formula hard to understand is that it's not a particularly strong heat clearing formula, but nonetheless, it is able to treat conditions of damp heat or damp warmth by stimulating the normal movement of fluids and having the heat exit the body through the urinary system.
And it sounds like because it is so strongly dealing with the fluids, it's like the heat goes out with the fluids. It's got nothing to hold on to.
Absolutely.
Yeah, this is not a formula that I know very well. I appreciate your explanation of it. The main thing I remember about Sanrentang is an article that I read by Dan Bensky like many, many years ago, and he talked about this very thing. In fact, he really enjoyed using it for a number of different things. I'm gonna have to go dig that article out and like go bone up on it since we're having this conversation. But the main thing that I remember is the way that it did work the fluid metabolism through the 3 different burners.
Yes.
And that's always been the thing in the back of my mind about that. But honestly, I have not really used that formula much in my practice, hardly ever. And I hope that I do not have an opportunity to do so. But I'm going to go bone up on this one because it might be really helpful in this situation, given circumstances.
I also hope, though, that you don't need to wait for an externally contracted illness to use it. That's one of the powerful things about, the formulas from the Shanhan Lun and from the warm disease tradition. Many of these formulas that were originally used and can still be used for externally contracted illnesses, oftentimes also are very effective for things that are internally generated.
Mm-hmm.
And so sanrentang can be quite useful even if you're not thinking about using it for COVID-19
Of course.
or some other externally contracted illness.
Right.
Yeah.
If we see a situation where someone's got dampness in all 3 burners there, and maybe especially if they're in a damp environment, that could be really helpful for their, air quotes here, arthritis or digestive issues. I mean, this is one of the beauties, of course, of Chinese medicine. One of the reasons I love it to pieces, and it drives me crazy at the same time, is that, this one formula, you can use it in these varied ways, but it really takes that understanding of what are we looking at and what's the dynamic that's involved.
Right. And again, right, it goes back to, are you doing good differential diagnosis?
Which is hard.
It is hard.
And I found for myself, I have to be willing to be wrong a lot, to really take a stance. This is what I see. This is what I'm going to treat, and be willing to deal with it if it doesn't go the right way, and hopefully learn something from it.
And one thing, Michael, I think since we're talking about formulas and you mentioned to me earlier that you saw something about maybe a suggestion of using yin chao san for this situation, or having people stock up on that or something like that.
Mm-hmm.
And I think, one of the things that I'm certainly not a warm disease scholar, but in this pattern from, I listened to some of the work that Jin Zhao has done, and in conversations with Ma Shouchun, who's a doctor here in Seattle, this idea of there being a damp component in these patterns seems to be fairly consistent. And if that is in fact the case, then I think the use of yin chao san could potentially be quite problematic, actually. So I don't want to say it's good or it's bad. What I want to say is the idea that you would use it reflexively without actually looking at a patient's tongue, without actually hearing about their symptoms, without actually doing the differential diagnosis that we do, that's not a good idea. And it doesn't matter whether a formula is yin chao san or sanrentang or anything else. It's just not a good idea.
I think that's a really helpful point. It's so easy to like read something and go, oh, this person used it and it was helpful. That means I can. It means maybe I can. If you understand the dynamic, you understand the mechanism. Well, good luck to you out there. Maybe we'll come back at some point if we need to for updates as things evolve here. I've got a feeling it's our turn at bat. Throughout history, Chinese doctors have had to confront these sorts of epidemic situations, or pandemic, perhaps, situations. And it's fun reading the history and thinking about it. But man, I'm telling you, I feel like I'm up here at home plate now and my knees are a little bit wobbly.
Yeah, I hear you, Michael. And I hope that, frankly, I hope it doesn't come to that, because if we really end up on the front lines, it'll mean that there's been a complete breakdown of the mainstream medical system. And I can't see how that would be good for any of us, frankly.
Agreed. Thank you for your time today.
Thank you. I appreciate you doing this and trying to get some information out into the community, and look forward to talking to you the next time.
Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, You can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Geological.